Now to concerns that a rising wave of COVID cases in China could cause a spike here in the U.S. The Biden administration has announced new mandatory COVID testing requirements for all airline travelers arriving from China. Effective 1 week from today, they'll have to provide a negative COVID test before boarding their flight. CBS News congressional correspondent Scott MacFarlane reports.
Hospitals in China are overwhelmed, pushed to the brink, and funeral processions are constant. The world's most populated nation is awash in COVID, and many areas are unprepared.
If you go to Beijing, they have so many good hospitals. But if you go to third-tier cities or like rural areas, it's total difference.
But at the same time, after months of protest and unrest, the Chinese government abruptly lifted its strict zero COVID restrictions, which had limited movement and the spread of the virus.
China has suddenly loosened up its restrictions left and right. And that's just provided an extraordinary opportunity for this virus to just, like a volcano, explode.
So, starting next week, the U.S. is joining a growing list of nations requiring people traveling from China to have tested negative for COVID within 48 hours of departure to be allowed through.
Ready for testing?
And the Centers for Disease Control announced it's expanding its COVID surveillance program at U.S. airports, in which passengers volunteer to undergo a nasal swab to better detect a new wave of cases. Health experts hope these new measures help.
No barrier is perfect, but putting up this barrier for testing is a prudent thing to do to try to keep potential new variants out of this country for as long as possible.
And I want to bring in Scott MacFarlane right now to talk more about this. So, Scott, this strategy hasn't been successful before. So why is the Biden administration trying it again now?
Well, the world seems to be synchronizing this response. The U.S. is not the only country trying this. Italy, India, Japan are all implementing these new restrictions or these new requirements for travelers from China. The synchronization may help. Doing it collectively, multi-nation may help. But yeah, doctors have been pretty clear about this. We tried travel restrictions at the outset of the pandemic, and there was limited value. It couldn't stop all the spread of all the virus or all the variants.
And Scott, what is the CDC saying right now about the situation unfolding in China?
The CDC, in addition to urging these new requirements for Chinese travelers, is also trying to expand this surveillance testing, this voluntary nasal swab for travelers from China, for international travelers, to detect a spreading virus or new variants. They're trying to be proactive and expand the reach of what they can do. That's an indication of the size and scope of the danger, the threat that's posed by really what appears to be the potential bomb of virus from China, where the restrictions are eased, the strict restrictions are eased, and the potential spread now could be far and wide.
And how would that work, Scott, in, let's say LaGuardia or whatever airport rather? How could that work, these testing requirements? I mean, are you going to say, oh, I'll be the person to do it, or are they going to come up to you? How does that exactly work? I mean, I've been just sitting here talking to so many people who are stuck, stranded in airports, and I'm wondering how this could impact things.
Well, first of all, it is a voluntary program. Nobody would be required to undergo a nasal swab against their will. There may be some outreach to bring people over, but the key here is that they're expanding the number of airports, the breadth of this testing, adding airports with heavy concentrations of international travelers. Think LAX in Los Angeles, Seattle, here in Washington and in New York. Expanding the number of airports and the volume of testing may help better detect, again, not just the spread of virus or the intake of virus into the U.S., but those new variants. And that really is the epicenter of the concern, new variants for which our vaccines are not resistant.
That's what it's all about. Scott MacFarlane up dark and early for us. Thank you so much.